It's the first time in Chennai we have done this.
மாமியாரும் இருக்காங்க, மதரும் இருக்காங்க, but they're clueless in helping the women how to feed the baby.
6 months வரைக்கும் maternity leave இருக்கு. I'll take care. After 6 months it's fine. I can go to job. That's the idea all pregnant women has. The expectation of the baby and what we are giving is totally different. But when a mother thinks that she is unique, she is different. But when it comes to a kid alone, எல்லாமே மற்ற கிட் மாதிரி இல்லையேன்னு ஒரு ஆட்டோமேட்டிக்காக ஒன்று திங்.
Peer pressure.
இது என்ன ஒரு குழந்தைன்னா ஒரே இடத்துல உட்காராம ஓடி ஆடி விளையாடிட்டு இருக்கு. இந்த டெர்மினாலஜியே இப்போ மாறி போச்சு.
Each child is unique, each child's needs are unique.
மதரை தான் டார்கெட் பண்ணுவோம். நீ என்ன சாப்பிட்ட, நீ சாப்பிட்டனால தான் குழந்தை அழுதுச்சு. பட் அந்த குழந்தைக்கு ஒரு ஆக்டிவிட்டி கொடுக்கணுன்ற ஒரு ஐடியாலஜி ஃபேமிலியில் தெரிய மாட்டேங்குது. எனக்கு போர் அடிக்குதுன்னு சொல்கிறது அது அண்டர்ஸ்டாண்ட் பண்ணாமல் பசிக்குதுன்னு நினச்சிட்டு தே ஃபோர்ஸ் ஃபீட்.
Yes. அந்த குவாலிட்டி ஆஃப் வாட்டர் நீங்கள் எப்படி பார்க்குறீங்க?
No, you shouldn't do that.
Hello everyone. Today we are starting our podcast series. Here I am with one of my friend and a colleague, Dr. Jayakrishnan, who is a clinical physiotherapist. நானும் ஜெயஸ்ரீயும் சேர்ந்து நிறைய புதுசாக சர்வீசஸ் கொண்டு வந்திருக்கோம் at Bloomlife. It is not that we wanted to develop new services. It is just that as there was a demand with our patients, we identified those demand and we started providing those services together. ஸோ அது மாதிரி இப்போ புதுசாக ஒன்று ஆரம்பிச்சிருக்கோம். அதை பற்றி தான் இந்த பாட்காஸ்ட்டில் பேச போகிறோம். அண்ட் லைக் ஃபார் எக்ஸாம்பிள் when I started as a obstetrics and gynecology practice, then I identified there's a lot of need for lactation consultation. That's when we started doing it together. That is educating women about how to feed and posture for feeding the babies, different techniques to take care of the newborn child and the madri. So then we started doing something called prenatal fitness and prenatal physiotherapy and exercise classes for pregnant women so that we can reduce the number of C-section we do in our practice. Adha eppadi reduce pananonu paakumbodhu then we started doing this. Similar way there is a need for இப்ப current situation la பார்த்தோன்னா there is a lot of generation gaps. Like முன்ன காலத்தில் there was a joint family culture where ஒரு டெலிவரினாலே ஒரு 10 பேர் கூட சேர்ந்துருப்பாங்க. டெஃபினெட்லி there will be one party, அத்தை மாமா சித்தி எல்லாருமே இருப்பாங்க. So many people were there to guide the new mother and the newborn child. ஸோ ஒரு ஃபியரே இருக்காது. எல்லாருக்குமே அவங்கவுங்க எக்ஸ்பீரியன்ஸில் இது ஓகே, இது நார்மல், இப்படி செய்யலாம், இப்படி செய்யக்கூடாதுன்றது சொல்லித்தரத்துக்கு ஆள் இருந்தது. பட் இப்போ பார்த்தோன்னா திஸ் லாட் ஆஃப் நியூக்ளியர் ஃபேமிலிஸ் அண்ட் couple are living alone in Chennai. And even for me, I don't know whether I will be able to be the right person to guide my daughter when she delivers a baby. I don't know what is right and wrong. இப்போ கூட என்னோட பேஷண்ட்ஸ் பார்த்தோன்னா 2 மாமியாரும் இருக்காங்க, மதரும் இருக்காங்க, பட் they're clueless in helping the women how to feed the baby. So then we had to go and assist and teach the mother and the mother-in-law how to help the new mother. So in that sense, now we have started something called Baby Spa. Can you explain why we've started this baby spa, Jayashree?
See, this, as you said, we've been exploring one stage after the other. We felt all women are quite sufficient in training themselves for birthing and preparing the family, everything. And once after delivery, when they ask to them, நீ என்ன பிளான் வச்சிருக்க after delivery? 6 months வரைக்கும் maternity leave இருக்கு. I'll take care. After 6 months, it's fine. I can go to job. That's the idea all pregnant women has. But what they will do with the newborn? How far the mother or pregnant women எவ்வளோ ஆக்டிவாக இருக்காங்க during pregnancy. The baby is also observing that mother, what and all the mother is doing. That's why most women says, most of the babies are not night sleepers or night wakers. When you see the history of the pregnancy period, what they had gone through. ப்ரெக்னன்சி டைமில் எனக்கு நைட் ஸ்லீப்ஸ் கம்ப்ளீட்டாக இல்லை, டிஸ்டர்ப் ஸ்லீப்ஸாக இருந்தது. எழுந்து ஐ வாஸ் மூவிங் அரவுண்ட், ஐ வர் நாட் ஏபிள் டு ஸ்லீப் கம்ப்ளீட்லி. கரெக்டாக எந்தெந்த டைமிங்கில் அந்த மதர் வாஸ் வேக்கிங் அப், த சேம் டைமிங் த பேபிஸ் ஆல்சோ would have been waking up after delivery. So this schedule, the baby has been observing the mother more closely than the mother knows herself. So when we were seeing this, there's a lot of generation gap, as you said, not only for pregnancy, birthing, even for baby care, there's a lot of generation gap. இப்போ இருக்கிற பாட்டி இதெல்லாம் கேட்டால் எங்கள் காலத்தில் இந்த மாதிரிலாம் குழந்தை இல்லை, அவங்க பாட்டுக்கு இருப்பாங்க. We just take it and feed and just keep it on the mat. They'll be quiet. But this one is always demanding. தூக்கு இருந்து தூக்கியே வச்சுட்டு இருந்தா கை சோகம் கண்டுடும். So there's something called warmth of the body. ஸோ கை சோகம் கண்டுடுச்சுன்னா தென் குழந்தை உன்னை விடாது. They will not move away from it. But the expectation of the baby and what we are giving, it's totally different now. So we need to understand the baby's expectation, attention seeking is high now. ஒரு 3-month baby expects someone to keep talking. யாரா பேசிட்டு இருந்து ஆக்டிவிட்டி கொடுத்துட்டே இருந்தா it's quiet and calm. If no one is there, it gets cranky. Lift me up. Why are you making me lie down? I just keep on seeing my ceiling. I need to move around. I need to see different things. Their attention is just a second. After that, they have to see for something else. But for the working women who have to see both career and also equally take care of the baby, it's very challenging. So they have to plan on taking care of the baby, but mostly they think by 2.5-3 years I can put them in the preschool. But from 6 months to the 2.5 years, what they will do, many are clueless. So when they come to us to asking, எப்படி என்கேஜ் பண்ணுறது இந்த குழந்தைய, துருன்னு இருக்கும், நாட்டியாக இருக்கு, என்னால் கையில் பிடிச்சே இருக்க முடியல. நாட்டினஸ் இஸ் பீன் அ டேர்ம் இஸ் பீன் யூஸ்ட் ஃபார் ஆல் கிட்ஸ். ஹைப்பரான ஒரு வார்த்தை கூட விட்டுடுறாங்க. பட் அந்த குழந்தை என்கேஜ் பண்ணணுன்ற ஒரு ஆக்டிவிட்டி ஷெடியூல் யாருக்கும் தெரியல. When we start talking with these new mothers, we thought we need to give them a plan on how to take care of the child even when they go to work. The people at home can schedule an activity. So அவங்க schedule ரொம்ப simple. Once they get up, they can have a breakfast, they can have one activity schedule. They sleep, again another activity, and again they can have a nap, and that's what the mother comes. When we thinking of this only, we thought we'll start with this baby spa.
Okay, baby spa is basically an activity for the baby, right?
Yes.
And it is also very important for the tactile stimulation to develop and neurodevelopmental stage level. There are certain activities, there are certain exercises and tools which can help the baby in developing in a better way. Yes. So can you elaborate how this spa can help the babies neurodevelopmentally?
Earlier generation, they usually keep the babies on the mat, on the floor. Now it's always bed, cradle. They always used to this soft surface. So what happens now, these infants, once they grow to be a toddler, they choose only the soft surface. They are not fine with the coarse surface on the floor sitting, which the parents take it as a positive thing. என் குழந்தை கீழெல்லாம் உட்காராது, சோஃபால தான் உட்காரும். But it's not about that. We have to see the sensitization what the baby has gone through. So likewise, some babies have kind of sensitivity in water also. So at this era, everyone needs to know swimming. So some babies, they will have a kind of a fear in water, that water phobia mari sila babies irukkom. And water has a tendency of giving you buoyancy, of moving freely. Resistance is there, so that will help them to have more of muscular activity for them also. Many babies now, they have colic issue. உடனே குழந்தை அழுதா மதரை தான் டார்கெட் பண்ணுவாங்க. நீ என்ன சாப்பிட்ட, நீ சாப்பிட்டனால தான் குழந்தை அழுதுச்சு. பட் அந்த குழந்தைக்கு ஒரு ஆக்டிவிட்டி கொடுக்கணுன்ற ஒரு ஐடியாலஜி ஃபேமிலியில் தெரிய மாட்டுது. They always connect with the mother's eating habits and the baby's way of having the crying pattern. But when the baby is being put into this kind of activities, yes, they get quite a relief from the colic, helps in digestion, and they have a better bonding. So we make sure here, in our setup over here, we make sure it's on the family members are around the baby. It's not the external people always there. We are there to supervise, but the family members are there. So it brings out real bonding with.
Can you tell me, like, நீங்க சொன்ன மாதிரி முன்ன காலத்துல சில விஷயங்கள் நம்ம ஃபாலோ பண்ணோம், which is not happening right now. என்ன பண்ணது இப்ப பண்ணல?
சில விஷயம் பண்ணது எதுவுமே scientific-ஆ was not right.
Yeah.
So which has been proved now, it is not right. So we have to update ourselves and we have changed to it scientifically. But sila activities like making the baby to explore things have gone too much with this generation. Mainly first time parenting irundha, they want to do the best to their child. So குழந்தை பிறக்கிறதுக்கு முன்னாடியே கிரேடில் எல்லாம் வாங்கி வச்சுடுவாங்க, ரூம் டெக்கரேஷன் எல்லாமே நல்லா இருக்கும். தட்ஸ் நைஸ் டு see. but the baby wants to explore bigger world other than its room. So, like, mothers, they'll be so scared to bring the baby to the hall, to the balcony, even to the terrace. They think there'll be infection. Earlier days, not much of air conditioners are there. So now high incidence of air conditioners are there.
Light and air was freely available.
Those things have been restricted. And nariya floor activities they are always onto the mat. So they tend to turn and creep and crawling possibility. It's onto the bed and soft surface. It doesn't know if it falls, it will bang its head. So we are not giving them that exposure also. And suddenly, there's a jumping of milestones. So, crawl panada straight away okandadum. So, they feel proud as parents. It jumped, double promotions, they feel proud. But each milestone is important for the skeletal development. Each milestone is important. So, and the milestones important. In the stage pannano. Some mothers will get worried. It's a kind of boredom. எனக்கு போர் அடிக்குதுன்னு சொல்றது அது அண்டர்ஸ்டாண்ட் பண்ணாம பசிக்குதுன்னு நினைச்சிட்டு they force feed.
Yes.
So இந்த அண்டர்ஸ்டாண்டிங் எல்லாமே they're not able to receive from the elders because they are clueless. எங்களுக்கு ஒண்ணுமே தெரியாது. We'll just put the baby on the mat. We'll be in the kitchen. It cries. We'll just come feed and put it out because there are other kids are surrounding with that baby. The elder ones will be saying
there were like many children to learn from.
Yes.
ஒரு குழந்தையா வளரல. நிறைய பேர் இருக்கும்போது the baby can learn from others.
Yes, they keep on talking with that baby. So it keeps listening from the elder kid.
And neighbors kids will be there with the child. அதெல்லாம்
வெளியில போய் விளையாடுற opportunities
we don't know who's our neighbor.
That's true big thing.
So இப்போ இந்த baby spa இதுல நீங்க என்னெல்லாம் பண்ணலாம்னு இருக்கீங்க? I mean, what are you doing currently?
See, as of now, for the baby spa, we have planned from 3 months to 6 months onwards. The age limit 3 to 6 months, we are starting it. Depends upon the infant progression. As per the pediatrician, we discuss, we go through the medical history and we take the baby. And we provide them first nice lukewarm water. The water has been RO UV water. We make sure the safety of the water. By taking 3 months once water quality check has been done, and this RO UV water after every child who goes to tub will be changed, and the safety neck band is there, so there's nothing to worry whether neck control illa abdin romba worry irukada. So 3 to 6 months stage la start panni it can go up to 12 to or 14-15 months, depends upon to the height and weight of the baby. We thought we'll start doing it. So once they get into the pool, yes, we can expect different reaction from the infant. Some will be like overjoyed by moving the hands and legs really fast. Some will get very scared. They tend to scream or shout. So there should be sensitizing program. So it's not like everyone can go through the 30 to 40 minutes of session. Some kid will go around like 5-10 minutes and slowly they get themselves sensitized. After they got done with the spa thing and they come with the infant massage where the mother does it. It's not the pediatric physiotherapist who does it. She'll be guiding for the mother to do it. So the mother knows how to drain the lymphatic drainage. So that helps the baby to soothe and helps in relieving from colic and helps them to sleep better. So what happens is if they're having the morning feed and they're coming after 1 hour. So it should have a 45 minutes gap before starting up the spa. So after that, they can have the spa, they can go home, again they can have a nice nap. So its schedule has been set for them. So one of the engaging activities in the baby's upbringing, we want to bring this one also. Once they start developing with this kind of activities, yes, this helps them to move for the bigger pool. So once they come for 4 years or 5 years, they can move around with the baby pool and then it's easier for them to move with the swimming. More, again, all swimming benefits is being explored with the baby also. So not only that, we were doing of the Swama Mia sessions for 15 months babies, 8 months to 15 months. So that is another movement therapy. So you can move around with properties, hand and eye coordinations, socializing, where you get along with other kids, which is very important now.
I know there's a lot of children with stranger anxiety.
Yes.
So it's very difficult for them to leave the mother and go.
Yes, they get very scared to see other people, and that has been seen in their nighttime feeds. Suddenly they get up and cry. The mother doesn't know why my baby is crying. So in the skills ellame cumulative, we have this baby spa program along with the play gym, that is the Mama Mia.
So I think you start from the 6 months of the baby.
Yes,
till 15 months of the baby, you have different activities.
Yes.
And I know hydrotherapy and spa pati sonninga. And do we do massages for the babies side by side?
Yes, that is after they're done with the hydrotherapy, the mother will be taught to do the tactile stimulation. So this is very sensitive area. The babies are very specific to know who's touching them. The warmth of the hands, the texture of the hands, they know very well. Even a deep sleep baby, when we change the hands, it will wake up. They know whom they are with, the body smell, the touch, everything they know. So they're very clear on whom they are getting with that comfort. So on the specification, so it's not we are doing it, the mothers are being guided to do it. So the ingredient which has been used, it's a pure coconut oil. So we make sure it's a natural ingredient which has been used. And this has been again checked with the pediatrician based on the baby sensitivity for this product. So we have to check each and everything before getting to this infant massage.
So who's the person who's guiding this? If a mother solli tarathukku, who's doing that?
When I say pediatric physiotherapist, the second word comes in the mind of everyone. Physiotherapist. Why physiotherapist? Physiotherapist is meant to do only exercises. They think only ortho side, fracture leg, illana sports injuries. Only it is being taught to that sense. But in physiotherapy, we have different wings. We have ortho, neuro, cardio, pediatric, ops and gynec. So we have different wings. Under wing, pediatric physiotherapy is a very separate wing, but it's been mostly focused on the special kids. So on special kids developmental milestones delay, andha mari irukku. But even for a normal healthy term, infants also need help. So some babies are not able to have neck control at that stage. Some babies, as I said, jumping of milestones, which is not healthier. So milestones delay is happening for a normal term babies. So all these things, you need therapeutic in a play kind of activities, which has been approached by the pediatric physiotherapist. So it's not the pediatric physiotherapist does the baby spa. They are being guiding them and observing them completely, where the attenders, that is the baby's parents or grandparents, will be around it. When coming to this Mama Mia sessions means, yes, there are pediatric physiotherapists who be helping with the concept-based activities. So as they do, we may not understand what concept is going on. It can be a motor stimulation. Some kids have audio sensory problem is there. When they hear something loud, they just close their ears and they go and stand in one corner. They don't want to hear something loud. So some kids will not like some other kids grabbing things or sharing. So all the things is being seen and it's getting neutralized, getting to Mama Mia session. Many times, nama kids activities nale we think only from 2 years, 3 years onwards. But 2 years ku munnadiye nama podra base helps them to have a socializing skills when they go to preschools.
Fine. I think that's wonderful. Seeing that physiotherapists are coming forward to do all these activities. These activities are also done by other people, right? How do people differentiate? நிறைய பேர் இந்த மாதிரி பண்றாங்க, like early 1 year to tactile stimulation. There are certain activity play areas where people are allowed to teach. So how is it different?
See, but what the thing is, it's like we are seeing some activity and we are doing that activity. But we don't know whether that activity is required for us. it shouldn't become an hyperactivity problem for you.
It should not be the same for all the children. No, there should be some individualization.
Yes.
This the person should identify professionally. இந்த குழந்தைக்கு இதுதான் கரெக்டா இதை கஸ்டமைஸ் பண்ணி இண்டிவிஜுவலைஸ் பண்ணி தென்
இந்த குரூப் ஆக்டிவிட்டில we pick it out, this kid is not okay with this, then we have to modify it. அதுக்காக நம்ம தனியா அந்த கிட்ட எடுத்துட்டு வந்துட்டோம்னா again they become isolated, they lose that socializing skill also. So that's the reason we want to make it from the professional. Qualified pediatric physiotherapist will be able to identify, and then they deliver the activity based on the infant need. It's not the regular activities that mandatory that all kids should do. What happens is that where the difference comes.
Yes.
When there's a parent around, they start to feel a different. My kid is not.
Comparison, yes.
She's doing.
Yeah. The first thing I think people should teach is not to compare the children.
Yes.
Each child is unique. Each child's needs are unique, and capabilities are unique. I think they have to be developed in that way rather than putting a blanket and saying everybody should do everything together.
True.
I think the concept konjam maaranum.
But when a mother thinks that she is unique, she is different. But when it comes to a kid alone, எல்லாமே மற்ற கிட் மாதிரி இல்லையேன்னு ஒரு ஆட்டோமேட்டிக்.
There's a lot of peer pressure.
ஆமாம், சொசைட்டி ப்ரெஷர், பியர் ப்ரெஷர், அதுவும் ஃபேமிலியில் சிஸ்டர் இன்லா யாராவது சைட் பை சைடு டெலிவரி இருந்தாங்கன்னா இம்மிடியேட்டாக கம்பேரிசன். இல்லை ஃப்ரெண்டு, நம்மளோட ஓன் ஃப்ரெண்டே சேம் பீரியடில் டெலிவரினா அவங்க கிட் அப்படி இருக்காங்க, என் கிட் இப்படி இருக்காங்க. ஸோ அவங்களுக்கு என்னதான் தெரிஞ்சாலும் அவங்கள மீறி சில விஷயம் வரப்போ, ஸோ திஸ் கைண்ட் ஆஃப் குவாலிஃபைட் பீப்புள் who keep telling the scientific knowledge onto it, they understand on which aspect they have to concentrate. So this movement and musical therapy which helps the baby to acknowledge which kind of concept they are interested into it. So this comparison நம்மள மீறி நம்ம கூடயே பின்னாலே வருது. It's not like we are that kind of person.
We want it and it just happens.
It just happens. We are very careful that we shouldn't do it. But நம்மள அறியாமலே sometimes it falls on to us, and சில டைம் நம்மள அறியாம சொல்ற மாதிரி கூட ஆயிடுது. Then we realize, oh my God, I did it, so I happen to say so அப்படின்றது
நானே நிறைய பண்ணியிருக்கேன். Don't worry. So I've done so many things like that.
So it's not like we are like that. பட் நம்ம சொன்ன மாதிரி அந்த பியர் இது நம்ம கண்ணில் படுறப்போ நம்ம மனசுக்கும் கண்ணுக்கும் நம்மள அறியாமலே அந்த மைண்ட் தாட்ஸ் ரன் ஆயிடுது. ஸோ அப்படி இருக்கப்போ ஒரு சயின்டிஃபிக்காக ஒருத்தவங்க அதுக்கு எக்ஸ்பிளனேஷன் கொடுக்குறப்போ, ஓகே என் கிட்டுக்கு இதுதான் வரும் போல, ஸோ இதில் நான் ஸ்பெஷலைசேஷன் அவனை பண்ணிக்கலான்றது ஒரு அர்த்தம் அப்புறம் தான் வரும். இல்லைன்னா எல்லாருமே ஒரே விஷயத்த பண்ணுற மாதிரி வில் பி புஷிங் our kids to the same track. பட் அதுக்கு ஒரு டிஃப்ரெண்ட் ட்ராக்கு தெரிய அது எப்படி கண்டுபிடிக்கணும்னு கூட சில டைம்.
I think you people will be helping mothers identify the unique skill the baby has, right?
Yes.
இல்லைன்னா அவங்கள அப்படி கண்டுபிடிக்கிறது.
ஆமா.
No, you love
தெரியாது. இல்லைன்னா வீட்டில் இருக்கவங்க சொல்றது வச்சு சம்டைம்ஸ் வீட்டில் இருக்கவங்க ஓவர் ரேட் பண்ணலாம், இல்லை அண்டர் ரேட்.
கரெக்டாக சொல்லலாம், கரெக்டாக இல்லாமல் சொல்லலாம்.
ஓவர் ரேட் பண்ணுறது ஒரு சின்ன விஷயத்துல நிறைய பண்ண மாதிரி சொல்லலாம். சிலது நல்லாவே நார்மலாக பண்ணியிருப்பாங்க, இருந்தாலும் இல்லை அந்த குழந்தை மாதிரி இல்லை, அந்த அண்டர் ரேட்டிங்கும் இருக்கும். ஸோ வி லிட்ரலி டோன்ட் நோ வெதர் our kid is doing fine. ஸோ சில பேரண்ட்ஸ்லாம் they think மேபி இந்த ஹைப்பர்ன்ற வேர்டு ரொம்ப காமன் ஆயிடுச்சு. குழந்தைன்னா இப்படி ஓடி ஆடி விளையாடுறது போயிட்டு, இது என்ன ஒரு குழந்தைன்னா ஒரே இடத்துல உட்காராம ஓடி ஆடி விளையாடிட்டு இருக்கு. இந்த டெர்மினாலஜியே இப்போ மாறி போச்சு. ஸோ மேக்கிங் த பேரண்ட் டு அண்டர்ஸ்டாண்ட் யோர் சைல்டு இஸ் நார்மல், அந்த கான்ஃபிடென்ஸே இப்போ கொடுக்க வேண்டியதா இருக்கு. ஸோ யூ ஹாவ் டு see that my child is normal, how to progress with it. So it should have lot of mental, physical, even that has a lot of psychological stress. They say even for a newborn they have trauma, birth trauma.
They carry forward the birth trauma.
They carry forward the birth trauma. So they say even
I think the holistic approach in போனா நிறைய people won't believe this or understand that நிறைய and I mean the concept wise differences இருக்கதா செய்யும். When we go into holistic-ஆ ஒரு குழந்தை பிரசவிக்கிறது அப்படிங்கிறது it's a very holistic thing. You're bringing a human being, another human being into this world, and the purpose of that baby is going to be totally different. இதெல்லாம் பேசினா நிறைய பேசுறப்ப
But I'm saying, but it's all starts from the time it's conceiving. Many incidents of when we talk with these new mothers, no, they say, during my pregnancy, my husband was away, I was alone, so I used to cry a lot. So I can see my baby is very fussy, it keeps on clinging on to me. But compared to the mothers who are like very independent, were moving around, those babies wants to be very independent. They don't want to be held all the time. So we can see that replica of what the mother had gone through on the child's development. It's not only the emotional and physical alone, it's even psychologically also it's seen. So it's so important that we have to get along with their family also. Unga family la eppadi, how's your lifestyle, how is it going on? அதுக்கேற்ற மாதிரி அந்த குழந்தைக்கு என்ன தேவையோ that way we have to focus. Each one's family is very different. So we have to see to that and make on that individual development தவிர்த்து it's not on to the common one, not suit.
There's a saying called, that's one of my favorite saying, that the best doctor treats the disease. The great doctor treats the patient as a whole. No, you have to see everything, whatever the surroundings enna pannudu, where is this girl from, where is she coming from, what is she going through in her life. Ellathiyum paathu then again guiding her through her life is something what I think all of us need to do.
With our population, concentrating on that is another challenge. So when we have a facility where from conception until you have a baby, and after you have a baby also, we have extended our services. Till your baby is 2 years old also we have extended. So hope so mothers who are going through services with us can avail all this.
Yes, and I think it's quite beneficial too. So there are certain common queries which we get from the mothers. One is how good quality the water is maintained at. ஏன்னா குழந்தைய உள்ள போடுறோன்னா the quality of water நீங்கள் எப்படி பார்க்குறீங்க அப்படி.
So quality of water வந்து இங்க 3 months once we are planned to check it, and it's a complete ROUV water. And every child the water is being changed. So it will take some time for the water to refill. So we have a particular time period. Slots are being there. So it will be pre-booked. So it's not a walk-in services. It's pre-booked, and based on that, the services are provided. So how I expect as a mother for my child, that's what has been delivered to our clients. So you can 100% trust. If I'm putting my child inside, you can put your child in.
And do the child is allowed to wear a diaper? Because நிறைய பேருக்கு அந்த குழந்தை வந்து யூரின் போயிடுமா, மோஷன் போயிடுமா inside the water. That is one doubt they have.
So that's what 45 minutes after the feeding session they can come. And we make sure they have that waterproof person there. And as I said, it's been changed after the baby is used with the water. So the session being in the water is going to be 20 to 30 minutes and at most to 40 based on the baby's response.
And what is the temperature you maintain?
Lukewarm water.
There's no temperature as such.
So lukewarm water has been prescribed. So many people think நல்லா சுட தண்ணி குழந்தை நல்லா தூங்கும். இப்போ இருக்க pediatricians கேட்டாங்கன்னா அவ்வளோதான். They say no, you shouldn't do that. So it should be lukewarm water. And of course, water quality is something very, very important. That's why we are provided here with ROU.
Thank you so much, Jayashree. I think it's been a long conversation.
Yeah.
Thank you so much. I think you've elaborated about what we are trying to do and why it is important for the babies. And I wish do more services like this.
Yes, it's a dream come. It's the first time in Chennai we have done this. And many people were saying, I was searching to go to Bangalore, Hyderabad or Mumbai, but I never knew there's something here in Chennai. So for Chennai people, I think it's, we are here in your neighborhood. Please come and avail this. Thank you.
It's not just for our patients. I think we are